Whereas the majority of people with slightly poor vision can be helped with glasses or contact lenses, in Northern Ireland we estimate that there are between 6,000 and 10,000 individuals whose vision will not be helped in this way. These individuals are eligible for sight impaired or severely sight impaired certification. The Department of Health, in association with the Health Board, the voluntary sector and a number of other interested individuals, set up a small subgroup to look at the certification process. The aim was to modernise the process, to introduce new and appropriate forms, to improve the governance, to improve the pathway, to make more information about certification available to both professionals and patients, and most of all, to improve the process.
I was part of the Service Users Forum, which was set up by the Belfast Trust, and it was identified to ourselves. We were a collective of visually impaired people, and it was identified by other visually impaired people within the trust that they were having problems when trying to access services. So maybe if they were going to one of the shops or travelling at the airport or using public transport, they felt themselves that they were experiencing difficulties. So what we thought was that it would be a great idea if we had an identity badge that identified that this person has a visual impairment and may need some help. Now what the badge has on it, it has their photograph and it has their name, and there's no address, but it identifies that they have either they're partially sighted or they're blind. And what we found was that people were having problems going through some of the airports. You know, they wanted to identify to some of the staff who were helping that they had a significant sight problem, and by showing this card, it would identify to the staff that they were having problems and they would need some help.
Well, I'm part of a group met in the sensory team, and we thought up this idea about getting a card that if you went into a place, probably like a restaurant or somewhere, and you showed this card, and the staff would maybe have more of an idea that this card, yes, this person has sight loss, so we can get them to a seat and show them where the toilets, the direction of the toilets are, and that would be absolutely fabulous if we could get this card out and about.
Well, going out and about, whether it's in restaurants, airports, GPs, on the bus, basically, you know, to say, you know, I need help when I have a sight impairment. With me, you know, I have a guide dog, so it's obvious I have a sight impairment, but somebody who wouldn't have any aids, a cane or a guide dog, then it'd be helpful for them more, because if they bump into somebody or if they can't fill in forms or they need that help, they can just show that card.
Well, it came about because part of the reason for me is people will look at me and not see there's a problem with my sight. I would go into the shop and people struggling, and people are sort of watching you sort of a bit oddly, as if, you know, what's this guy doing here? And they don't realise you're struggling to maybe read a label on say a soup can or something like that there. Then the next minute you're getting into your packet or something, maybe pulling out your magnifying glass so as you can actually see what the ingredients is. And I think the card would be helpful if maybe, say, you go into like one of the big supermarkets and the staff sees you have this card and they would come and give you a bit of assistance. You know, maybe some people maybe take certain vegetables or something, and you want to know what's on this can of soup or something, maybe along those lines, you know, help that way. And we've come out with this here card, and we hopefully hope it's going to do well for everyone down the lane. You know what I mean? We are going to launch it, but we hope it's going to run for years and years and help people down the lane with eye conditions.
Okay, the card gives me a sense of security. It's nice, and a nice bright yellow, which unfortunately when I put things down I have a tough time finding them. So it is a nice yellow bright card, which is easily for me to identify because I'm sight impaired. I'm not completely blind. However, my eyesight is very, very bad. But what's important to me is that when I go places, especially ones that I'm not familiar with, it really gives me a sense of security, because I can always show this card and explain to people what my disability is. Whereas without it, a lot of people don't even know what your problem is. They know something's wrong, but they don't know really what. So this is good to have, especially in airports, shopping malls, any big places like this where you may lose your way, or even in downtown Belfast or anywhere. If you lose your way, you can always show somebody this card, and they'd be more than willing to help you out, or find somebody that will help you out. Oh, the card is perfect. It is actually the exact size of a credit card, so you can slip it in your wallet with just your other credit cards or whatever you may have. So it's really quite convenient and easy to carry with you, and that way you don't forget it. Sometimes when I go abroad or whatever, I use a white cane, and sometimes I've actually forgotten it, being in a hurry. So this being in your wallet, it's kind of hard to forget now, isn't it? So I like that part of it, because I did go on one trip at one point. I was being met at the other end, but it didn't help me in the airport. I had to go through a process of explaining that I had a sight disability.
At the beginning of this programme, Professor Jackson explained the first stage of certification, where an ophthalmologist diagnoses a person with either sight loss or severe sight loss. This generates an automatic referral to social services, where the second stage takes place. This is important, as we know through experience of working with people who have been certified that this is a difficult time for them. They experience uncertainty about the level of their sight loss, its possible impact on their work, education, caring for children or older relatives, communicating and getting out and about safely. Sensory support staff will assess the person's needs. If the person gives consent, we will place their name on our trust database for people certified with sight loss, which we have a statutory duty to maintain. This completes the certification process, and the person will then be eligible for benefits such as free travel on public transport. As you have heard, our service users are experts in their situations, so it is important that we listen and learn from them in order to improve our services. They have highlighted the barriers that people with certified sight loss experience when trying to access a range of services, including inaccessible communication, lack of understanding of their needs, poor accessibility to premises. Service users acknowledge that there are many examples of good practice and support provided by some agencies and companies, but there is always room for improvement, and they would like to see a time when such support would be more widely available. Our service user group suggested that a CVI ID card would be useful, as this could be a visual prompt to inform others that they have a certified sight loss and might require assistance. All service users across the region who are eligible for certification will now be offered the Certification ID card, which is the first card of its type, and we hope will become widely recognised and used within Northern Ireland. This is an excellent example of co-working between the Trust and our service users, and we thank them for their contribution and support with developing the card.